Thank you so much, DJ, for joining me today. I'd like to ask you, what do you think is the biggest question in digital health which has yet to be answered?
Well, I have no doubt in my mind that it's the question that's most important in digital health is how do we join up effectively all the systems which are currently in use to try and manage patient care. At the moment, we have really deep systems which sit in acute hospitals, in GP surgeries, in community care, in mental health trusts. None of them talk to each other. People have talked about creating data lakes and shared care records, but I actually don't think that's really joining things up. My question would be, how do we do effective care coordination for patients as they move, as they inevitably do, between medical and non-medical, so between healthcare and care, between the different settings that patients inevitably go through. Patients have very long and complicated journeys, and we do not serve them well with the current setup of how we have systems in lots of different places that don't, it's not that they just don't interoperate, it's that they don't talk to each other. It's actually that they don't share common ways of progressing the patient's care and making it possible for people to collaborate. That's the question we have. How do we?
It's a very big question.
It's huge, and I mean, I would say that because my company, Careful, is dedicated to trying to solve that problem. But I think it's a huge problem, and it's global.
Yeah. Okay. And please, could you tell us something that you learned about digital health in the last year, which you'd like to share with our community?
Well, I'm privileged in that our company is a member of the UK Department of Business and Trade Digital Health Playbook, and we've been invited to a few places over the course of the last year in order to export our product, one of which was to India, and one of which is to Saudi Arabia. And we've also spent time working with colleagues in Latin America and also in the UAE. So we have been exposed to a lot of different places, a lot of different countries where digital health is at a different stage of development. What surprised me was the degree to which many places that we might think are developing have actually created healthcare systems which are far ahead of anything that we have in the UK. We are not laggards, but we are certainly not, as a country, at the forefront of digital health. There are many countries in this world who have done more, gone further, and succeeded better in creating really good digital health systems. And I guess that what I've learned is that while the UK is an excellent place to be a patient and a caregiver, for the most part, the standards of our digital products are not as good as they are in many other parts of the world.
Okay, so following on from that, DJ, what would be your aspirations for the UKDHC?
Well, the reason I joined the UK Digital Health and Care as a director, and why I'm very excited about it, is that we can affect some of those important changes through the effective working together of a community of interested clinicians, caregivers, specialists, and we're so lucky in that we are awash with talent in this country, and having an effective voice for that digital health community is something which can affect change. We know it can. We've seen it in the past, and we know that there is a lot to do, and we hope very much that UKDHC will be an effective voice in UK digital health and care.
And hopefully, you know, it'll be something great to be a part of. I understand that the UKDHC will be running a series of webinars and other events. Is there anything in particular that you're looking forward to?
Well, we're very excited that we've got a scientific conference, which is happening in September. Professor Wallace is organising that, and we've got quite a long way into finding not just the venue, but also the speakers. It's going to be a great event in September in Preston, and for anybody who's interested, they should go onto the website and sign up to the mailing list, and we can send them more details in the future. The other thing that I'm looking forward to is really listening to people who have wide experience of digital health, not just in the UK, but potentially from other parts of the world, to come and share their thoughts, their understanding, their experiences, and so forth with this wider community. We can learn so much from each other, and the idea of having a not-for-profit organization that is dedicated to trying to promote great standards in digital health and to really improve what we can deliver for patients is very exciting. We're very excited to have UKDHC formed and ready to help the digital health community and to help patients.
And that's all that I have to ask. Thank you so much, DJ.
Nita, thanks so much. It's really nice to be here, and thank you so much for inviting me.
Thank you.